Welcome, everyone. Thank you so much for joining us. We're going to hold on just a minute here while our platform's letting everyone in. But as you're joining, you'll notice your camera is automatically off and your mic is automatically muted. We will have you stay that way throughout today's presentation, but we encourage you to use the chat. So as we're waiting for our platform to let everyone in, feel free to go to the chat, give us a greeting, let us know where you're tuning in from today. We would love to hear from you. Welcome, welcome. I see our numbers growing. Hi, everyone. We are just holding on while our chat or waiting room's letting everyone in, but feel free to head to the chat. I see lots of messages coming through.
Lovely.
We have people joining us from all over today. So great to see you all. Hi, everyone. Wonderful. Well, welcome everyone. Thank you so much for joining us. And we're going to go ahead and get started because we have a lot of great information to share with you in the next hour. Welcome to today's webinar, Living Mentally Well with Chronic Pain Conditions. My name is Jackie Zimmerman. I'm the Public Education Associate at Mental Health America's National Office, and I'll be helping moderate today's webinar. I have just a few notes for you before we get started. This webinar is being recorded and will be emailed out to all registrants within 1 week. We currently do not offer CEUs, but if you would like to request a certificate of attendance, I do have a form that you can fill out to request one of those. I'll post that in the chat here shortly. We will have a little bit of time at the end today for some Q&A with our presenter, so please feel free throughout our time to post any questions you might have in the chat, and we'll be collecting those and then go through some at the end. And that leads me to introduce our wonderful presenter we have with us today. I'm so excited for the session ahead. And first we'll introduce Dr. Melissa Gerety. Dr. G is a licensed clinical health psychologist and CEO of Phoenix Rising. She has over a decade of experience fostering the mental health, self-management, and perseverance of patients and their families. Dr. G brings a diverse background with experience working as a clinician in outpatient, inpatient, partial hospitalization, intensive outpatient, residential, and hospital settings. Dr. G is also a keynote and international speaker. She's developed a solid reputation as a compassionate, humorous, and unconditionally accepting advocate of her patients. We are so grateful to have you joining us here today, Dr. G. I will turn it over to you and let you take it away.
Great. Thank you so much for having me. I'm going to go ahead and share my screen right now. All right, let's get this going here. Lovely. And again, just many thanks to Mental Health America and the Association of Migraine Disorders for allowing me the very big honor to speak today on such an important topic that's near and dear to my heart. So as in the introduction, yes, I'm a licensed clinical health psychologist and all these other fancy things, but I think most important is I'm a complex medical patient. I have well over 30 medical diagnoses. I recently stopped counting, and most of those involve very complex pain conditions. So I'm in pain 24/7. Medicines do not work for me. I'm one of those people. So I have to really rely on my coping skills and strategies to be able to live with chronic pain. And I'm going to have the honor today to share some of that with you. So the learning objectives today is understanding how living with chronic pain conditions can affect mental health, identify the warning symptoms to report to healthcare professionals, and learn strategies for living well with chronic pain. But before we begin, let's just settle into our chairs or our bed or wherever we're at and just take a few deep breaths, right? Just like, let's get into this moment, because while this is going to be great information today, it's going to be a lot and it can feel overwhelming. So anytime you feel overwhelmed, take some deep breaths and know that this is recorded. You'll be able to access all the resources after, so no worries on having to write anything down. You can just be in the moment, right? And also note that some of the slides are quite busy, and that's my style because of one, my own brain fog. I don't want to forget anything. And two, I just really want you all to have the references when this is over, so you don't have to feel like, what was she talking about? It's going to be all there. So we're going to get ahead and get started, and we're going to talk about comorbidities. So what are comorbidities? There's 3 definitions for it, and it's essentially just a fancy way to say a person has a multiple, at least 2, multiple chronic conditions or medical conditions that aren't chronic that go together, or maybe they have the conditions and they don't relate to each other, but they're still there. So it's just a person with a lot of conditions, to make it easy. One example is the migraine community. There are so many migraine comorbidities other than quote unquote just pain. There's IBS issues, gynecological issues, all of this. And of course, the mental health piece, which we're going to talk about today. And how could we, as people with such complex medical conditions, not have difficulties with mental health? And note that I didn't say that mental health caused the difficulties. No, I have actually never met a pain patient who was faking because of a mental health condition. Like it's not all in your head. And so we're going to talk about that today for sure. So I laugh when I see this because this is how I imagine myself trying to keep in all my symptoms in check. It's like my conditions are like the velociraptors, and I'm just kind of like, okay, my POTS is flaring, then this is flaring, and that's flaring. Like, what do I do next, right? And so it's a lot for us to have to figure out which condition needs our attention at the moment, what's going to flare if I attend that condition, or what's going to be helped. It's a lot. And to learn more about having compassion of your comorbidities, I have a webinar that I did, and you can go to my website and watch that webinar just to learn more about this topic. And so chronic pain is, of course, tied with psychological suffering. Of course, how can it not be, right? So if a person in pain continues to miss out on opportunities to connect with others due to their pain, they may think that they're controlling the pain by staying at home. And yet the pain will just remain. It won't change, right? So days, weeks, months, years later, the person's still going to have pain, but now with the burden of a life that doesn't feel fulfilling anymore if they're not engaging in the things they care about. So really living well with chronic pain is about balance. It's trying to figure out how to quote unquote control the pain, but really truly live. And so that's what I hope you get out of today. And it's important to note that as this Mental Health America study shows, there's a bidirectional relationship with chronic pain and mental health. They affect one another, right? So if I am having a ton of pain and I'm frustrated about it because I'm doing this webinar, and why did my jaw pain have to a flare up today before I'm speaking for 60 minutes, true story. I could easily get really frustrated by that and then tense up my shoulders and tense up my jaw more and all of that, and then have more pain, right? Or I can kind of lean in and be like, of course this happened. And so now I'm just going to take some time to kind of center myself, accept that it's happening. I don't like it. But I'm going to do what I care and value about anyway, which is this wonderful presentation to all of you. And so it's no wonder that in addition to medical and physical implications, chronic pain has far-reaching impact on employment, health, mental health, right? Just life in general. And of course, there's many studies that show that people who have chronic pain have elevated risk of psychological distress and depression, right? This one study from about mental well-being of chronic pain talks about how both greater intensity and pain interference have been independently associated with elevated depressive symptoms and lower mental well-being, mental health well-being in pain populations. And we know that, right? We've felt it. And so it is important that people with chronic pain should be screened by a medical professional for commonly known occurring conditions. So that would be depression, anxiety disorders, substance abuse disorders, PTSD, bipolar disorder, and this is just to name a few. So a 2019 analysis by Mental Health America showed that they had 38,000 screeners who took these mental health screeners. And one found that 48% of people who took the PTSD screener also have chronic pain. It also found that 20 to 50% of people with chronic pain also have depression. And I believe that number is probably higher in the general population. But again, this is just based on people who were going to this website for screeners. And also 36% of people who took these screeners reported never receiving any treatment, or that they were and then they weren't receiving it. Other people who screened positive for moderate to severe mental health conditions, 40% of those have never been diagnosed. So those are huge statistics of people not getting help. And 48% of people with chronic pain who are receiving treatment indicated that their treatment isn't sufficient to meet both their physical and mental health needs, which is really, really sad, right? And so why are more people not getting mental health support? Well, there's a lot going on here. One, high cost and insufficient insurance coverage, right? We know that. So 42% of the population saw cost and poor insurance coverage as a top barrier for accessing mental health care. And 25% of Americans reported having to choose between getting mental health treatment and paying for daily necessities. And of course, there's stark disparities in accessibility at state and income levels. So there's a lot going on. There's a lot of reasons. Another is limited options and long waits. So 96 million Americans, or 38%, have had to wait longer than 1 week for mental health treatments. In recent years, 1 week is nothing. I've had patients have to wait 6 months, 8 months to see a psychiatrist. And nearly half of Americans, or about 46% of us, have known someone who had to drive more than an hour round trip to seek treatment. And as someone who's really medically complex, a lot of my specialists are over an hour away. I have my neurosurgeons out of state. And so just imagine being met with all these kind of things. You're new to the chronic pain world, and now you have to figure out how you're going to drive an hour or get there if you don't have personal transportation. It's a lot on a person. There's also the lack of awareness. So while most Americans do try to seek out treatment, there's also a large portion of the population who have wanted to, but they didn't know where to go. They didn't know that some of these services were available that we're going to be talking about today. And of course, there's stigma. A lot of people just feel like, I don't want to get judged. I don't want anyone to know that I'm seeing a therapist. So people just don't go, or if they do go, they don't talk about it. So then, we get the screenshot of what I say online. Everyone has these beautiful pictures and are doing so well and are pain-free and, living life well. But that's only a snapshot, a screenshot of their lives. We don't know what's going on underneath. And of course, exhaustion, pain, and feeling overwhelmed. It's super hard to seek out mental health care when we're feeling all these things, even though that's when we likely should be seeking it out, right? And so this next part, I want to delve a little bit into some warning signs where you should definitely report it to a healthcare professional. So this is not an exhaustive list, but we're going to go through it. And I'd like to kind of start and say that the beautiful thing is that with mental health, you don't need any warning signs to benefit. Everyone could benefit from mental health support. But these are some of the signs that really, I would encourage people to talk to someone if they're having any of these or combination. So if a person's having suicidal thoughts, talking about wanting to die and has a plan, maybe they're giving away items and not seeing a future, feeling hopeless. Maybe they're not keeping up with basic hygiene. And that could be related to mental health concerns or because of their chronic medical conditions. Not engaging with friends and loved ones, so they're isolating. Not finding pleasure in things that they used to find pleasure in. Not feeling like yourself, and that's however you define it, just feeling blah. Feeling anxious much of the time, having repetitive thoughts, having racing thoughts, not being able to concentrate as used to, feeling down, depressed, not eating enough or eating more than typical. So these are some things that warrant some need of attention, right? And so you have these concerns, but then what do you do with it? Where do you report this? And so if a person doesn't already have a psychologist or a counselor, I suggest reporting those concerns to their primary care physician, and they can see if their primary care physician has any referrals for a therapist. But if people don't feel heard by their primary care physician, or if they don't have one, you can absolutely visit these resources to try to find a therapist. So Mental Health America has great resources. The Association for Contextual Behavioral Science, which I'm a part of, has great resources. Psychology Today. And also you can reach out to your insurance company and ask for a list of therapists in your network as well. And so you want to be really concise and clear when you report your concerns. And what's best for me, especially with brain fog, is writing them down before your appointment and bringing them into your appointment with you so you don't forget anything. And it could be something like, I'm sleeping less than 4 hours a night. I'm having racing thoughts. I also keep shifting positions a lot due to shooting pain in my back. It's difficult for me to concentrate at work and I feel overwhelmed much of the time. So this gives the mental health professional a snippet of what your main concerns are. And based on this, then they can ask further questions so they can know how to best support you. And Mental Health America has a great resource on their website, Working with a Provider, that discusses more of these things in depth as well. And as always, if you're in a crisis, which means that you're at risk of harming yourself or others, you can go to your local emergency room or call 911 and have an ambulance get to you, or you can call or text 988 for the Suicide and Crisis Lifeline as well. All right, so let's strap in because we are going to have a whole bunch of learning right now from here on out. So this is the meat and potatoes of it, the learning strategies for living well with chronic pain. So a lot of information here. So it is about finding what works for you, and you won't know what helps until you give it a try. So, and I've heard everything when people want to bring up excuses of why they want to try, and I've said some of these myself too. So I've heard, I'm not the relaxing type. It won't work. My family needs me, so I don't have time for myself. I'm in too much pain. I'm too tired. What will people think if they see me doing nothing? I do so little as it is. This can't possibly make a difference. My pain is real. It's not in my head. It's selfish to take time for myself. I already have too many things to do. I've tried it before. It didn't work. I have ADHD, so I can't pay attention long enough. So whatever your thoughts are that you've had of these, it's okay. Carry them with you and try anyway. And again, it's important to know that because chronic pain impacts every portion of our lives, how we cope often takes many different approaches. It's not just one thing that's like, oh, that works and that's all I do. No, it's like a lot of different things. So we're going to talk about that now. So one really helpful thing for people is finding support groups and peer support, right? So there's peer-led support groups. These are not for everyone. Sometimes people find that some peer-led support groups are kind of a complaint fest, to say it nicely. So you might have to like search for groups that are good for you, that you don't feel like it's a complaint fest. Like, that's up to you, and that's your choice. So don't be disheartened if the first couple you try aren't for you. Keep trying, try again. There's also mental health professional-led support groups. Support groups can be in-person, virtual, Facebook support groups, online forums, and they can also be disease-specific. So a group for fibromyalgia, a group for spinal cord injury, a group for migraine, or some groups can be general chronic pain groups. And some examples of where to find groups are Mental Health America has peer support. Chronic Migraine Awareness has lots of support groups. And the US Pain Foundation has their Pain Connection support groups. And all these occur in different times and different formats so that people can find what is best for them. Another thing is podcasts and webinars, just like all of you are here today. And Mental Health America has an amazing In the Open podcast for you to listen to. Association of Migraine Disorders has Spotlight on Migraine podcast. The US Pain Foundation has pep talks, and the International Pain Foundation has webinars. And so these are just a few of the main ones that I view myself to stay in the loop. And of course, movement. This can be a big controversial one, but movement really does benefit our mental and physical health. But with my experience, it always looks different, right? So if my chronic fatigue is in a flare, I'm not going to be able to go on my recumbent bike, but I may be able to just do some stretching, roll my shoulders, some gentle yoga positions, and that's still moving. And it's really important for us to have consistency in that movement, because sometimes we feel like we need to brace ourselves, and if we don't move, maybe things won't get worse. But then a lot of us will find that actually not moving will make things worse for us in the long run, and we end up getting more pain. So it's important to check with your medical professional to kind of see what's best for you. And also, even if they might have suggestions, you're the best resource. So you'll kind of determine, okay, I can move right now, I can't move, or I can do this. So it's about being gentle with yourself and just meeting yourself where you're at. And mindfulness is one of my favorites. So mindfulness means paying attention on purpose in the present moment and without judgment. And this is something we strive for. We can't be perfect on this. Even Buddhist monks can't be like completely mindful all the time. That's not how our brains work. But mindfulness at the core is really about participating in life and not watching life pass you by. And it's important to note that mindfulness is not a Band-Aid fix. A cure-all does not always result in relaxation of your mind or your mind going blank. My mind never goes blank, so I don't know where that one got started, that rumor, but it's not that. And it's not psychobabble hippie stuff. Like mindfulness is just, can be formal, informal. It's just paying attention to the moment. So for example, right now, a bunch of you may be in a variety of different pain flares, right? But you're still watching. And so maybe your pain, distracts you for a little bit, and then you come back to the webinar, and then something else in your pain alarms, like your chest starts to hurt more, and then you get alarmed by that, and then you come back. That's mindfulness. That's just doing it over and over again to engage in something that you care about. And right now it's self-care, being on this webinar. And what's really cool about mindfulness is there's actual studies about how it heals people. There's actual changes in brain structure. It shrinks the amygdala, and it's just an amazing thing. It can decrease cortisol levels, can increase immune function, it can increase well-being and quality of life, and can enrich relationships with ourselves, others, in the world, because we're just trying to be more in the moment as much as we can. And one thing I find most important for the chronic pain world that we're in is it allows us to reintegrate our mind and our body once again. I describe it as if a lot of us with chronic pain kind of walk around as like we're like a head, unless if we have migraine pain, then it's like here. We walk around with like a little part of our, and we want to like disassociate from everything else, right? And then we're not really living, and then we're not being able to kind of meet the needs of our body if we're just trying to ignore it all the time, because eventually it's just going to start screaming anyway. And so mindfulness is really about, okay, I'm noticing this pain. Let's try to come back to this moment. And here's an example of how I work with mindfulness of physical pain. So the first portion, P, is pursuing the present moment. So breathing slowly and deeply. And you can do this by noticing colors, objects, and noises around you, just trying to ground yourself in the moment, even if you have to do it a million times a minute, just coming back to the moment. And then you allow yourself to lean into your pain. You make room for it. Acknowledge its presence. And remind yourself that when we ignore or distract from our pain, we can only do this for so long before the pain intensity heightens. And so a lot of people, when we're first learning about this, are like, allow yourself to lean into your pain. Why would I want to do that? And again, it's because if we try to ignore it, maybe that will work for a little bit, trying to distract and ignore it. But that's not going to help forever. And we're still going to be missing out with having that connection with our bodies, and to try to, again, learn more things about ourselves of, oh, okay, when I have this type of pain, this type of coping skill works well, paired with like a heating blanket, like being able to know ourselves. The next portion of this is interview your experience, be inquisitive. Am I experiencing stabbing pain, lightning pain? Am I feeling sad, frustrated? So that's about leaning into what you're dealing with in that moment. And sometimes this part can feel very overwhelming. And so people will kind of detract from it and like, nope, I don't want to go there. But it's also very important for the healing process to be able to lean in and kind of be curious about what's going on with your body and mind. And then the last step is about acting on your values. So values are the things we care most about in life, such as self-care, relationships, creativity. So in this moment, should you use a heating pad, color a mandala, talk with a loved one, pet your dog, cuddle up with a blanket and movie? Like, what can you do for yourself in this moment? And so I actually talk about all this in a webinar I did. It's a 3-part webinar, Mindfulness and Chronic Pain, Going Beyond One's Psychological Suffering. So you can go ahead and check that out on my website. So psychotherapy, of course, is another way that we can help with everything that we have to deal with living in a world of chronic pain. And it can look like individual, couples, family, group. There can be expressive therapies such as art, music, dance, equine therapy, acceptance and commitment therapy, which I'll talk about in a moment, dialectical behavioral therapy, which is a lot of awesome coping skills, and mindfulness-based pain management. There's lots of different mindfulness-based therapies. And what's interesting is I actually recently came across this MBPM. And what I learned is that it's based in the UK, and it was developed by a person who lives with severe spinal pain. It's an 8-week online group course, which is really interesting. And so it's things like this that can make mental health more accessible to people who can't see, for whatever reason, an individual therapist or group therapy. So so that's another awesome, interesting option for us. And also on my website, I talk about in some articles what a pain psychologist is. So you can like learn more about that and what us pain psychologists do and how we can help. And also I did a webinar on acceptance and commitment therapy as well. So you can learn about that more if you're interested. Also, a great course is Empowered Relief, which is an evidence-based single-session pain class that rapidly equips patients with pain management skills. It was developed at Stanford University. I took the class. I'm a certified instructor, and it's really awesome because it's about, I run my class around 2 hours and 15 minutes, and it's online and it's live. And it's just a really great way to understand, again, rapidly, how we can take care of ourselves if we do not have access to like a weekly therapist. And you can absolutely sign up for my mailing list if you're interested, for finding out when my next class will be. So, chronic pain, waiting, right? A lot of our experience is waiting. We're waiting for a pain flare to lessen, waiting for meds to kick in, waiting for doctor's appointments, waiting to pick up medications, waiting for tests, waiting to be well enough to meet up with our friends, just waiting. That's like encompasses our life, right? And if we use this waiting mentality in terms of our values, it turns out we'd be waiting forever and we wouldn't do anything meaningful. So for example, if I told myself when I feel less pain, I'll be able to do X, Y, Z, well, then it's probably not going to happen. You know, we all have the ability to live our lives and our values the best we can given our circumstances. And so it is possible to live with chronic pain and lead a valued life. And of course, our lives may not look as how we intended, but again, they can still be beautiful and full of meaning. And so an example of this is, you know, instead of feeling like when I feel less pain, I'll meet up with a friend, right? Instead of that, it could be like, all right, I'm going to text this friend, or maybe I can Zoom with them if I'm just not able to meet up with them. So it's still living your values, right? And acceptance, there's that acceptance piece again. And of course I do acceptance and commitment therapy. So I'm really big on this acceptance piece because it's really liberated me from kind of the shackles my pain has given me, especially in the beginning and at different times throughout my life. And what I like about this type of acceptance and commitment therapy is it's acceptance with resilience. So there's acceptance with resignation, and that steals more hope than pain can itself steal. It just is like kind of laying back and like, oh, this is my life and I might as well do nothing because nothing is going to be how it should be anyway, or nothing's going to be without pain. That's acceptance with resignation. But acceptance with resilience makes it possible for a person to reinvent themselves on the other side of the problem. So it's about doing those things that you still care about while you're in pain, not waiting for life to just pass you by. And so acceptance and commitment therapy is all about working towards psychological flexibility. It's leaning into the moment, accepting that moment for what it is, not what we wish it was or what we want it to be. It's about using our skills and living our life by our values. And so that's very empowering to me, and it has been to my patients as well. My favorite ACT book is The Happiness Trap. And so this goes through acceptance and commitment therapy, the whole gamut of values, mindfulness, coping skills. I love this book. I've read it a million times. I have my patients read it. We go through it together. We highlight things. We create new coping skills based on what's best for the patient. Like it's a really great read. I really like it. So we have all these skills, but then what happens when the inevitable pain flare happens, right? So this beautiful picture of me is taken when I had a very severe migraine. I think this one was already lasting. I think this attack was probably like a 2-weeker, I think. And so I was just not having it. So I am comfortable in my zebra robe, but just not having it, right? And so we have to figure out how we can self-care in a flare. And that is, again, being in the moment, leaning in, accepting that you're having a flare. Remember, acceptance doesn't mean you're liking it. Who would like a flare? But acceptance is like, all right, this is what's going on. What can I do about it? And while you're doing self-care, reminding yourself that self-care is not selfish. Self-care is not doing nothing. Resting and pacing is actually really powerful interventions of you're being quite busy. Your body is like taking time to heal and just regroup and get out of that flare. So if you can determine which conditions or symptoms are in a flare, then go ahead and try to figure out what's best for that. But if you can't tell what is what and you just feel like everything's flared, that's okay too. You can still help yourself out. And so it is about pacing if needed, resting if needed, laying down Netflix all day if needed, and reaching out to support. I know a lot of people in the migraine community do this when they're really struggling. They go ahead and go on the forums and be like, hey, I'm struggling, I'm miserable, this is what's going on. And just having that support from people that understand really can help and make a difference. And also reminding yourself that flares pass and emotions come and go. Harder to do in the moment, but it is about kind of like, okay, I've survived flares before. This one feels like it's never going to end, but I'm going to do what's best for me in this moment and kind of just focus on now. Because if we start to think about like, oh my gosh, what if this flare is like the last one and lasts 6 months and ends up with me hospitalized? That's not going to be helpful in the moment. So it's recognizing, okay, that's not a helpful thing for me to think about. I can't control my thoughts, but I can control what I do about them. So I'm going to have that thought. Thanks, brain, not helpful. What can I do in this moment right now? And again, you're going to use your coping skills, grounding, deep breathing, mindfulness, right? Another thing that can help us with our chronic pain journey is doctor appointment preparation. The plight that we have as complex patients is that we feel like if we say too much, we're assumed to be over exaggerating. And if we don't say enough, we're not going to get properly helped. So it's really frustrating, right? Because we have to figure out what's the sweet spot so I can like really express my concerns and the seriousness of this and be heard and understood, right? And so there's some that say people who maximize their pain experiences need to be confronted and taught that their behaviors are counterproductive, though in an encouraging way. And that can just be really like intimidating of like, well, I am, like having all this. I did feel like I was going to die the other night. So, my condition got so bad. So it's really hard sometimes not to use those words to try to be able to express where you're at. And so it is unfortunately having to come down to a lot of times the professional, the medical professional. Can you switch doctors if you're not feeling heard, or if you're feeling gaslit by this doctor, if they think you're just over exaggerating or maximizing your symptoms? What is best for you? If you have to stay with this professional, how do you deal with that? How are you able to talk to this person knowing that they might minimize your information? And I'll talk about some references of how you can learn more about this later, because it takes balance. It's important for us to recognize that we do need to prepare for doctor's appointments. And so if you go to my website on my blog, I have written an article about medical history and current medications, a binder that I use myself. And it's a real pain to, no pun intended, to create. It takes a lot of mental energy. So I suggest people, just don't do it all at once. Believe me, I tried, not good mentally and physically. So you just want to pace yourself. And it essentially has your current medical team on it, your medical diagnoses, mine's like 2 pages, your current medicines and vitamins, any discontinued medicines and like why you discontinued them, if there was like side effects or it wasn't helping. And so for me, this really helps, especially when I'm seeing a new specialist, because I can't go through my whole medical history by memory. That's way too much. I'm bound to forget stuff with my fog. So this is a great way also for doctors to make copies and have references for later. It's just a great a great like time save in a lot of reasons. One way I use this for good or bad is when I go to a new doctor appointment and they're like, what diagnoses do you have on their form? I always put C printed sheet. I'm not going to write my 30 diagnoses down again. So here you go. It's right here. So it's really helped me. But again, you have to pace yourself when you're doing this because it is a lot of information. I would be remiss if I did not mention medical gaslighting. And so you'll see a lot of resources on this page because we don't have time to talk about all of it today. However, I have done a lot of talking already about this in podcasts, a PowerPoint I have on my website for free for people, webinars, articles. So definitely hop over to my website, Phoenix Rising with Dr. G. Ton of free resources on medical gaslighting, how you can handle things if you, again, have to stay with a doctor who you don't maybe think hears you as much, or how to advocate for yourself, assert yourself. It's all on there. So definitely take some time to look through some of these to be able to honor your experience, because honestly, I have never met a person with chronic pain, chronic illness, anything like that, who hasn't been medically gaslit to some extent, which is really sad. But it's also really important for us to know that you're not alone and that there's ways that you can start to heal from your experiences of this. All right, just checking the time. All right, we're doing good. Oops. Let's go back. Got slide happy there. So advocacy is a huge one that has benefited my life greatly and has allowed me to be really mindful, because I'm really trying to all right, I have all this stuff going on in the background with myself, with my pain and my conditions, but being able to help others helps ourselves. And what's really cool about advocacy is many people find it empowering. They start to find their voice. You find your people and your support system, people who have the same diagnoses as you. Also, I'm a rare disease patient. So sometimes if there's not many people with your diagnoses, you end up in these fabulous support groups and end up advocating for more research just because there's not a lot out there. So it's really lovely to have that. And our voices in continued advocacy also honors the people who are no longer with us, right? And so that's just a beautiful thing, to be able to use our voice in ways that represent people who can't advocate for whatever reason. I've done personally Headache on the Hill several times. And I always think about, when I go, whether it's virtual or in person, that I'm representing all the people who don't have a voice, all the people who are in severe migraine and headache disorder attacks at home where they can't be there. People who just feel like they can't speak at all about it. So it's really powerful and an honor to be able to go to these events and feel like you're representing your community. And so a lot of people will be kind of overwhelmed of, where do I start? And you can decide which disease or mental health condition you'd like to focus on, and you can start to look up nonprofits online. So for example, like I said, I'm very involved in the migraine and headache community. So Headache on the Hill just made sense for me, and I got into it and loved it. And so you can visit them. Mental Health America has many awesome resources on policy issues on their website. And another example is Shades for Migraine, which is a really fun advocacy event that takes place on June 21st every year, where you wear your shades for migraine and you really just are able to spread awareness. And so again, it's about doing these things at your pace, right? Because you don't want to go all in and then feel like, oh my goodness, that's a lot. Because advocacy, while it's really empowering and helpful, it can take a lot of mental energy and physical energy. So it is about pacing yourself, maybe doing a thing and realizing, wow, that was too much. I got to step it back. And, then trying another thing, but you won't know until you try. And that's really with all of this, as I said before, is you won't know what works for you until you try it, and try it a few times, more than a few times. If you, for example, if people try informal mindfulness, coping skill I give them and it doesn't work, quote unquote, the first time, you got to try it again and try it in different circumstances and different situations to see what's best for you. And then you can find what coping skills and what, different things you can do to combine that really helps you live your life to the fullest as you can. And as always, I am available for contact on my website. Again, I have a ton of free resources on my website of podcasts and webinars and articles and all of that for people to be able to access. And also, I would be remiss if I didn't, just also give a shout out to the Association of Migraine Disorders. And they just have wonderful resources as well that you can follow. So I am going to go ahead here and stop my screen share and go back and just wanted to say first, before we go to questions, just thank you for listening. Again, I know it's a lot of information. So taking some deep breaths, knowing that you can come back to it as much as you need to. And just again, pace yourself and figure out what's best for you.
Absolutely. Thank you so much, Dr. G,
Absolutely.
for all of that information. And again, thank you to the Migraine Disorder Association for helping bring all of this together today. I appreciate everyone's engagement in the chat and also vulnerability in there as well, sharing their own
Nice.
experiences. And I know this is a topic that everyone who is living with chronic pain, depending on their condition, might experience things differently. And I think that is what a lot of you were talking in the chat about, things that may work or not work. And so I just appreciate all of the information you provided today, Dr. G, because it really is such a personal journey to figure out what works for you. And it can be time consuming and challenging,
Yes.
draining. And that's another thing to acknowledge too, is just the mental drain of trying to heal and trying to feel better and trying to improve your mental health. It's not always easy, especially when living with chronic pain. So thank you all for sharing your experiences in there. I know there were a few questions specific to particular medications and things like that. We won't get into those today, as that is more of a specific conversation depending on what you're physically dealing with and very personal to each person's specific condition. So we won't go through any specific medication type questions today, but please feel free to post other questions in the chat. I'm pulling some of those, but one that I wanted to start with today is just of all of the things that were presented today, for someone who might have a new diagnosis, or that this is kind of their first step in learning about what to do. Sometimes asking for help or taking that first step in healing is the hardest. What do you suggest for individuals out there that are just kind of starting this journey and really, really struggling?
Yes, that's a great question. So if someone's newly diagnosed, I suggest that if their diagnosis has a nonprofit, start there, because a lot of times it's like, here's a diagnosis, here's what happens, here's how you can get help on the nonprofit site. If your diagnosis doesn't have a nonprofit, you can still go to general medical sites and just type in Google how to deal with a new diagnosis. And so again, it is about educating yourself. And that's the best way of like trying to learn more about your diagnosis, doing a lot of Googling, looking at journal articles, just making sure that you understand what your diagnosis is and the expectations. And then you can bring that information to your doctor if you have one, and then talk about that with them of like, okay, what do you typically see in patients who have this diagnosis? What do you typically recommend for next steps? And so all of that can be very helpful, especially when you're newly diagnosed, because it's overwhelming. Another thing that I recommend is if you're newly diagnosed and your diagnosis has like a Facebook group page, join it. And you don't have to, you can be like the silent observer. You don't have to engage. You can just watch and learn. When I was first diagnosed with my rare disease, tethered cord syndrome, and felt very overwhelmed, I did just that. I just watched and learned what other people were saying. I read studies that they posted. And then when I felt more comfortable, then I started to engage, and it was really helpful. So it's totally fine to be a silent bystander at first because it's overwhelming, right?
Yeah. Absolutely. I love that tip because it is hard to share at first, and sometimes those peer support groups or other in-person events might seem a little intimidating or overwhelming, especially if you are dealing with anxiety
Yes.
or depression or other mental health conditions at the same time.
Mm-hmm.
Sometimes going physically to those places can be hard. So I love that idea, getting involved in those online forums and being that silent observer and
Yep.
hearing from others on their experiences. The next question I have from someone in the chat is, how do we advocate for ourselves in the workplace, especially when we have longer flares? And I know this is a loaded question.
So loaded, and I could do a whole presentation on just that. So when you are in the workplace, of course, it's hard because by law, you don't have to disclose your diagnoses. But what could help is getting a letter from your physician that states some accommodations that you'll need, and they don't have to put your diagnoses. Now, some people feel that it's empowering and they want to disclose, but other people, especially when it comes to mental health diagnoses, are concerned they're going to get judged. Even chronic pain diagnoses. I remember when I was in college, I worked at this one place, and it was like a data entry place, and I needed to have the screen, like a screen riser, so I wouldn't have my neck go down. And I remember I had a doctor's note, and I gave it to the manager, and she laughed, crumpled it up, and threw it in the garbage. And I ended up getting the riser, but this wasn't needed. And especially, like, most people had risers, so it wasn't like a big ask. It was so little. But that's a very big fear people have about accommodations in the workplace, because they hear stories just like mine. And that was one of the milder things I've experienced. But it is about still advocating for what you need. So whether writing, I find, is more empowering. If you have understanding managers, you can have a discussion with the writing from your physician of what you need. But really, it's just about seeing what's best for you. There's not a blanket answer for that, because it depends also on your work environment.
Okay. Can be an active challenge. I know equally outside of the workplace too, if we have anyone who's a student joining us, they might be facing similar things as they're going through their coursework, but accommodations Absolutely. Are available, and you have a right to them. And so that's really what's so important, is that continued mm-hmm. advocacy. And I know organizations like MHA and others out there continue that work towards advocating for those types of accommodations, so that individuals don't have experiences like yours. But yes. It can be a barrier and fear for a lot of people when asking mm-hmm. them for an accommodation. But just know that you have a right to those.
Yep, absolutely.
Another question that I saw come through from a few people, I know that you had lots of resources about medical gaslighting on there, but a few individuals are wondering if you could just give a brief description or overview of what medical gaslighting is.
Absolutely. Great questions. Yes. So medical gaslighting is essentially when you are in it can happen anywhere, but I'm just going to use an example of a medical professional interaction. So you're in there, you're at your appointment, you're talking about some things that you're dealing with your pain. And then the professional looks at you and goes well, that shouldn't happen with that condition. Or you're over exaggerating, that pain can't be that bad. So those are some examples. A real life example that happened to me that I share a lot is when I was this was grad school, I think, when I was in grad school. And it's good that this did not happen today, because now I have the skills to handle this, and the person would have had words. But when I was in graduate school, I went to a new neurologist because I was starting to have this different type of migraine attack, and I didn't know what it was. And it was very severe and it was very scary. So my pain physician sent me to this new neurologist, supposed to be one of the best in the area, blah, blah, blah. Right. So I go in with my, five-page list of medical, my medical document that I talked about earlier. And he just looks at the list. He sees my diagnosis of fibromyalgia and some of my other ones, starts to think, oh, it's all in this person's head. And he says, next time your husband marries, he should marry someone fat and ugly because they're too scared to be sick. That's medical gaslighting. So it just makes you come in to get help for something that's serious, and you get told something like that in an already vulnerable state. I couldn't even say anything. I was just so shocked and distraught because I thought I was coming for help and answers. And then I got met with that. I went back to my pain physician and my pain psychologist crying. And I said, I'm not going to another neurologist right now. You have to help me figure this out. I can't deal with that again. And so they were like, yeah. So my doctor he's amazing. And he did a bunch of research, consulted a bunch of his fellow doctor friends, and did a bunch of tests. And it was found out that I was having cluster headaches. So that doctor missed a very serious diagnosis because he was just too focused on, no one can have that many diagnoses. It must just be all in your head. So it was a devastating experience, but one that has really propelled me in the work I do for my career to help people, because this sort of stuff happens all the time. What I just shared there, while it's horrifying and shocking, is commonplace for for what I hear. So that's why a lot of the work I've been doing over the last couple of years is particularly focused on medical gaslighting, because enough is enough. No one should be told that when they're trying to get help and answers.
Absolutely. And as you said, many people share common experiences. I have the chat pulled up and I'm keeping an eye on it as we're going through all of this. And many people are saying they've had similar experiences, or a lot of experiences where you're saying it's all in your head, the pain will go away, it's all in your head, really just minimizing that experience.
Yes.
And that it's so frustrating, I'm sure, as patients are going through this. And I know as MHA has gotten more into our chronic pain and chronic disease work, that's something that we're hearing time and time again from those who are living with these conditions, is just the frustration of not being believed. Absolutely. And the impact that has on your mental health in itself. And then you start to question yourself of, am I going crazy? Is this in my head? But no, I'm having these physical symptoms that are so just debilitating to my daily life that it can't be. And so it's incredibly frustrating that people have to go through this when they are just trying to be better. So I thank you for your work on that topic, and just bringing it up. So many people in the chat too are saying, I didn't realize that that's what that was called, but I've experienced this. Other people saying, but you don't look sick is another comment.
Yes. You don't look sick is a big one I hear. And also but you're so young. My disorders don't care about my age. What? Why is that even one? But it is a big one that a lot of people will hear as well.
Absolutely. Absolutely. Just another part of advocacy that we have to continue bringing up and educating on and working towards, and really also educating within the medical system for practitioners to have that understanding of the complexity of chronic pain and chronic disease.
Absolutely. When I went to Pain Week at the end of last year, I had a room full of, maybe 200 medical professionals, and I presented about medical gaslighting, and I presented a case study, and I went through the details of this case study, and I stopped and had them figure out what was going on with this person. And of course, there were some people who were like, maybe it's just anxiety. And on the inside, I'm laughing because one, the case study was about me, but they didn't know that yet. And so towards at the very end, the last slide was like, okay, and the diagnosis is actually tethered cord syndrome, which I had been told by multiple people that my conditions were not progressive. I was just exhibiting a lot of like stress and anxiety. And it turns out my tethered cord syndrome that I've had since before I was born was progressing in a way that I could have been paralyzed. So I had very real symptoms that were dismissed as anxiety. And this just happened 3 years ago. And so I talk about all this, and then, you know, the audience finds out that it's me who it was, and they were just like floored. And what was cool about it is a lot of people came up to me afterwards and like, thanks for opening my eyes to this, because now I'm going to try to look at things a little differently when I talk with patients who come in with a lot of different symptoms like yourself. And so it was really, I get goosebumps thinking about it, because it was really amazing to just kind of like instill that knowledge into medical professionals, because we need more of like, you know, if someone comes in with a list of symptoms, those symptoms are real. Like, they're not making it up. No one wants to go to the doctor with like, here's my 100 symptoms. Like, no, that's not a thing.
And of course, too, if you're going through all of these physical symptoms, that could increase your likelihood to develop anxiety.
Of course.
So you might still have anxiety
yes,
through this, but that is not the diagnosis for the physical pain
absolutely
that you are feeling.
Absolutely.
Yeah. Well, thank you, Dr. G. I know we're right at our hour, and we could probably talk for another hour on this topic. But I just want to thank you so much for being here, for your continued education and advocacy on this topic and in the field. We really appreciate you, and thank you for your time spent here with us today. I also want to thank all of you who have joined us. I appreciate all of the comments and thoughtfulness throughout today in the chat. We will be sure to share these resources with you. I know so many people are asking about the resources on the slides. We'll present you with those as well. Within the week, we'll send out the recording from today that you can share, as well as those slides, so that you can get all of the great resources that Dr. G talked about throughout today's session. So thank you, everyone. Have a wonderful rest of your afternoon, and huge thank you to Dr. G.
Absolutely. Bye, everyone.
All right. Bye. Thank you, everyone. Have a great day.